When it comes to making evidence-based decisions in research, policy, or practice, not all literature reviews are created equal. A systematic literature review, or SOR, is considered the gold standard for synthesizing evidence. It is a structured, transparent, and replicable method used to identify, evaluate, and summarize all relevant research on a specific question. The primary purpose of an SOR is to produce a comprehensive and unbiased overview of the existing evidence, done with high methodological rigor and transparency. Because of these standards, conducting an SOR is time-consuming and resource-intensive, requiring the close involvement of domain experts to ensure scientific quality. SORs are built on three core principles that set them apart from other reviews. First, they are designed to answer a specific research question. The process begins with a clearly defined and focused question that guides the entire review. Second, they are guided by predefined criteria and protocols. This includes search strategies and inclusion or exclusion criteria, all determined in advance to reduce bias and ensure consistency. Finally, SORs emphasize transparency, rigor, and reproducibility. Every step of the process is documented, allowing others to critically assess or replicate the review. SORs follow a systematic sequence of steps to ensure transparency and reproducibility. The process begins by defining a clear, focused research question, often using structured frameworks like PICO, which stands for Population, Intervention, Comparison, and Outcome. This step shapes the direction of the entire review and must be finalized before any data collection begins. Next, researchers develop a comprehensive search strategy. This includes identifying which database to search, the keywords or search terms, and explicit inclusion and exclusion criteria based on factors such as study design, publication type, date, and relevance to the research question. Once a strategy is set, the literature search is conducted across the selected databases. Using the predefined criteria, studies are screened for relevance, typically in two stages, first by reviewing titles and abstracts, and then by assessing full texts of potentially eligible studies. After selecting the eligible studies, the next step is data extraction. Key information such as study design, population characteristics, interventions, outcomes, and results are systematically collected using standardized data extraction forms. Each included study is then evaluated for quality and potential bias. Depending on the type of research, different risk of bias tools may be used. For example, the Cochrane risk of bias tool is commonly applied to assess randomized controlled trials. Finally, the extracted data and quality assessments are used to synthesize the evidence. This synthesis may be qualitative or quantitative, depending on the nature of the data. In some cases, a meta-analysis is performed to statistically combine results from multiple studies. Findings are compiled in a comprehensive report, often accompanied by a PRISMA diagram. The PRISMA diagram, short for Preferred Reporting Items for Systematic Reviews and Meta-Analyses, visually summarizes the flow of information through the review process. It shows how many studies were identified, screened, included, and excluded, increasing transparency and helping readers understand how the final set of studies was selected. In addition to systematic literature reviews, there are other types of evidence synthesis. A scoping review is used to map existing literature on a broad topic and identify gaps in knowledge. A rapid review streamlines the SOR process to provide quicker answers, often for decision-making in time-sensitive contexts. A narrative review is typically more descriptive and interpretive and less structured in its methodology. In summary, a systematic literature review provides a rigorous, transparent, and unbiased synthesis of all relevant research addressing a specific question. It stands apart from other review types through a structured methodology, use of predefined criteria, and careful documentation, ultimately supporting more credible, evidence-based conclusions.